All right, we are now beginning our Mayor's Roundtable, sort of. I'd like to welcome Beverly Mayor Mike Cahill, Amesbury Mayor Kassandra Gove, Gloucester's Mayor Sefatia Romeo Theken, Lawrence Mayor Dan Rivera, and Peabody Mayor Ted Betancourt. No. And Salem. I don't believe Salem's mayor is here as well.
He's here.
Who's
No, they're here.
Oh, okay.
Yeah,
Right, so
Betancourt's here.
I can't see everybody like I usually can, so I don't know why that is. But we'll get started here.
I'm also
Tom McGee from Linus on the call.
Oh, Mayor McGee. Mayor McGee, good morning. I'm sorry, I didn't even. This has been such a hectic morning. Thank you for joining us. I do appreciate it.
Yeah, good to be here.
So, just want to start at the top here and just see if we can start with Mayor Gove. Obviously, for this roundtable, COVID, it's just how have the cities on the North Shore responded to COVID? And Mayor Gove, if you're there, could you start us off, please? Did I lose her?
Nope, I'm still here.
There you are.
I'll
Okay.
be brief. We're, a very small town compared to some of my peers here. One of our biggest challenges was being on the border of New Hampshire, which might be unique to some of the other folks on the line, and just that our businesses and our residents often cross the border, whether that was for shopping or for business or work. And, they had different guidance and they were following different regulations. And so that was really challenging, or has been really challenging and ongoing for us. But we've done really well. We have less than 5 active cases. We're on the decline if you look at all of the dashboards and reports. And our largest concern over the past few months has really been our long-term care facilities. I think you'll hear that from a lot of us today, and from many people across the Commonwealth. So that was really our biggest challenge. That's really why our numbers in general are very high, but in the common population, we really handled it well and kept our numbers low. But again, dealing with our border to New Hampshire was our
Well, I think
for us.
Well, that's what I'm trying to find out about this with the Mayor's Roundtable, because, for example, Beverly, Salem, and Peabody sort of aren't of the North Shore. You've got people going back and forth all over the place. And Mayor Cahill, I wonder if you might come up next, please.
Sure. Oh gosh, so much. Just kind of the arc of what we've been doing since March. So early on, everything had to shut down, right? So we focused on trying to help make sure that our businesses and our residents got access. And I know we've all done this, access to all the federal and state supports that have been made available. So early on, it was, how do you access? How do you apply for PPP and other types of help? Somebody's train sounding. That sounds great. So initially it was a shutdown, then it was how do we reopen safely? Along the way, we have one place in Beverly along our waterfront that's the most popular spot in town to walk up and down the sidewalks. We tried something, we tried to make the sidewalks one way. It seems to have worked, with a lot of help. It seems to be working. We partnered up and kind of followed Salem's lead on mandating face coverings at all of our supermarkets and drugstores, other retail, back when only the essential stores were open. With our health department and a lot of positive reinforcement, that's worked well. It was well established before the state kind of went that way. Again, like everybody here, working with all of our businesses during the reopening to meet the guidelines, to help them understand, where our health department has just been incredible about this. And then with outdoor dining, I think we've all pretty much done the same to try to promote outdoor dining in every way possible to help our coffee shops and restaurants to try to survive this time. The summer has been a challenge for coastal communities, us being one of several on this call. We've had a lot of measures to try to limit the number of people on the beaches at a time. One thing we found helpful has been to really look at the tide charts every weekend, because the weekends have been the biggest challenge. When high tide comes midday, we limit the number of people we let on to a different extent. We have to turn people away in that way. We say you can come back later in the day when there's more beach. We monitor how things are doing on the beaches, and we kind of keep the flow of walk-on and drive-in traffic to our parks and parking lots based on that. So a lot of things to just try to help people do the keys, right? Keeping a physical distance from each other, making sure they cover their faces, making sure that they are thoughtful about interactions and still get out and enjoy the summer weather. So anyway, I'll stop there. Lots going on. I know Rick was going to go alphabetically. He seems a little frozen up. Who's next? Maybe Sefatia?
I think Sefatia should go next, even though she's muted.
Sefatia, you're muted. How could that ever be?
Because I'm considerate at times. I do listen, you know. Well, I'll go next. Actually, you know, it's the same thing all around. We started to do our process a little bit different. Before I closed the schools, I wanted to make sure some of the programs were in place. I do things a little different. Where I was in healthcare for 20 years, I had, when I became mayor, I started a network. So if we have cold days, you know, usually it only lasts 1 or 2 days in the winter, snow days. But since when we came in 2015, we had nothing but snow days. So I started this networking of all agencies, especially social services, and we do that for the hot days. So I was very fortunate that we still stay connected all the time. So I connected them, and we actually in the beginning got to, that's Rick, hold on. Yes, Rick. Hi.
We should just keep going because he's recording.
Well, you're recording. You know what? We're just going to talk about COVID among ourselves and anything else and problems we might deal with, and you can save it, and then next time we'll hook up, okay? I'll take over. Bye. Bye. Okay, so I'm taking over. Anyways, I don't know when we're going to stop recording. We'll just leave. But the fact is, I made sure, because we're lucky because I have an open door right here. We had the action shelter right here, so we did a lot of it. But what was really scary to me, to be honest with you, I had Denmark Nursing Home, which is like less than 2 miles here from Rockport. I had the, you know, Gloucester Health and Seacoast, and I'm going like, okay. So now I have 3 nursing homes in this small community, and also we had over 6 public housing, 7 elderly housings, over 600 elderly living in the public housing. We had to bring them aboard, the senior care programs, everything that we needed to do, we set it up. Back then, we actually got to see each other, and then we went Zoom. And my concern was too, is who's going to see our children if they're not in school? Who's gonna, when you do the Zoom, you know, it's different when you have a child that comes into school, you know, a teacher notices them every day and will notice a change if they're withdrawn or what's happening and what's, you know, and my concern was too, okay, so if you had COVID, if you were homeless, where are you gonna go? But what happens if you had an addiction? Okay, because we had a what shelter. What happens if someone's going through COVID? Then they're gonna go through withdrawals. No rehabilitation is going to take them with COVID. Where are they going to go? So how do I set that up? Who has that? So we were very fortunate. We have Action, and the Y was actually had to close down. So they said, May, we have space if you need it. Boy, they were talking about my PPEs. I gave them space. We set it up for the homeless shelter. The homeless shelter we used in case there was someone who had COVID and then also was going through withdrawal. I had a lot of doctors and nurses who were willing to volunteer that were retired, so we set that up. And I'm proudly to say that our homeless shelter tested like 3 or 4 times before they left, because they were in there from March all the way to July, all negative all the time, so we're very fortunate. And we had the community support as far as feeding them 3 times a day, and we worked, you know, raising money because the Y says we can give you the space, but we need someone there of our and you know, employment, you know, to watch the building, the whole thing. So that was really good. We worked very closely with senior care, make sure that, you know what, let them stay, we'll bring them food, because, you know, the grocery shop at Open Door was amazing. You know what, it started off with like 4,000 deliveries in a week with food, and we're still, it's still remote. They still, you know, they'll drive by, bring you groceries, and, you know, they'll still deliver all of that. Then we were, you know, the children in the school, we said to, with the, back then, Sapphire was the superintendent, these kids need to eat. You know what, we know that they depend on our lunches and our breakfast. We can't stop it. You know, how are we going to get it to them? And we put up a plan them too, so we can make sure that everyone was safe and who was coming. And then the school nurses, because my board director, her staff, I mean, that's just been amazing. But she said right in the beginning, hey, I need to hire some nurses, because if not, we're going to be in trouble. It's going to be a shortage. Go right ahead. You know, we were right at the beginning, and we got the school nurses to come aboard. So they were doing tracing. And actually, before tracing was even invented and called it tracing, we had our first, let's say, pod of people got COVID. They were in a prayer group. It was St. Joseph time in March, and these Italians had a prayer group, and 80% or over 90% of them actually got the COVID. And so I had to do the tracing because they spoke Sicilian and they really didn't understand and they didn't know about tracing. And it happened to be the one night that my board of director actually was taking the night off. And so when someone called me, she says, I got a strange call, I'm positive, and it was from the hospital. And nobody believed her. And so Jim and I said, Jim, the hospital's calling people saying they're positive before we could do anything, before he came back. So that was a shit show completely, because the fact is, when I called and I called all my old connections at the hospital, I said, are you calling people? She goes, we would if you had strep throat. We would if you had. I said, but what did you tell them to do after? Oh, call the CDC. I said, and that's it? Oh my God. So I started doing tracing. I started calling all the families that I knew, because I knew them all, and started telling them what they need to do. And then I called the Board of Health. And unfortunately, that even our Board of Directors of the Board of Health, even though he's a doctor, was not equipped with that MAVE that they do. You have to be certified, so it couldn't do anything. So in the beginning, it was kind of rough. It really was, until we got, all together and what we needed to do. And so the tracing was the best thing, because we got that whole pod of families to make sure that they stood put. 4 ended up in the hospital. 1 passed. No, actually 2 passed from there. I mean, it was scary. And I still have it in my ear. I still have to go to the ear doctor, the screaming that when I had to tell her that her husband has an hour left to live, and the screaming and the echoing, and then had to FaceTime the family in Italy to let them see their father that was passing, but it was horrible. It was horrible. I respect our nurses, and everyone has to do the tracing, because, and then we started up mental health services for them, because I'm telling you, it's not normal. What you hear and what you see, and hear, I'm sorry, but you have COVID and your husband, it's horrible. And so we had to protect the kid. Sometimes the caretaker needs a caretaker. And so we started a therapy hotline just for in-house in the beginning. So we did all of that, and we're doing pretty good. I mean, you know what, there's always going to be people who don't believe, and, as far as going one down, do like Beverly, I'm so sick of it. Do like Salem, do like Beverly, do like, I don't give a shit about them. You know what, every community is different. Sorry, but I cannot. I've got a boulevard. I've got, you've got all these things. I have all these beaches. There's so much you can do. It's totally different. We joke around with Kim. She's got witches. I got bitches. Absolutely, there's nothing we can do. And you have to respect yourself, and that's the main thing. And up until today, people still are going to do what they want to do. And it was difficult, and it's still difficult. And I think all of us here, the most difficult decision that we've ever had to make is whether we start school or don't start school. That's the worst. And all of them, I've had a team here. You bring it out. We did the survey to the schools, and they came back one way, and the teachers and everything else, and now we're doing negotiations, so I can't speak too much. And I'm just an appointee. I'm not the chair. Some people are chair of this committee. I'm not chair. That's not in our ordinance. I don't get paid for it, so that's not in the ordinance. There's nothing. And I have to also worry about the consequences is going to be on the city side. They don't understand that I am a mayor first. I'm an appointee second. The mayor has to worry about everything, the budget, the running, the operation, everyday skill, everything that we have to do here, the voting that's happened, city clerks. They don't understand that the consequences that one vote can take. So it's kind of hard. And a lot of the stuff, I'll be truthful, when it comes to budget and all of that, I just vote present because I have to see what we're doing. And the most difficult one that I said is, let's start. If we don't start, and we voted for the hybrid, and we're in negotiations, we have to start somewhere what we can do. And it's very difficult because, nobody knows. And that's the whole thing. It's not like, say, okay, well, the vaccine's coming, we're all gonna be, we just don't know. And right now we're safe, and, we're in the colored charts, but just like Kim was fine. And next thing you know, they had to withdraw. And, I don't know what's gonna happen in 3 weeks. I'm hoping that we're gonna be able to continue. I just want the kids to start now, because I know in my heart, I know it's coming back, and it's going to come back. And I know that we're not going to be able to continue schools or any of the other programs. I know that and it's going to be difficult is because I don't know what to shut down, because I know the economy, I know my main streets, I know my stores and restaurants that just are barely making it now, you know, and knowing that's going to be a rough winter. But if they had to shut down again, I'm gonna have a ghost town. You know, I'm gonna have protest. I'm gonna have a protest among of the, you know, the store owners and the markets and the restaurants and everything else. So it's difficult, and you guys are all feeling the same thing, and you're all seeing the same thing, and it's always our fault, and we're not doing enough. But I'll tell you something. I'm with you. So next, Dan, why don't you tell us how you're doing? You're muted.
You know what? It still gets me. Even then, we've been doing, you know, all these months of Zooms. I gotta tell you, I think you're right when you say that, you know, a lot of us are facing some of the similar things, but we're so different. You know, people say, well, you know, you and Lynn are the same. I said, well, no, you know, Lynn's got a golf course. I don't have a golf course. So yeah, they're dealing with different things. They got more kids than we do. And, you know, they got to see, you know, they're closer to the water than we are. So there's stuff that you guys are dealing with, Salem and Gloucester, that we're just not dealing with. But I think for us, it's been a perfect storm. So if you live in Lawrence, you're either one of those essential workers who had to work through the pandemic, or you lost your job because of the pandemic, or you lost your job because there was no daycare, or you got the virus. Like, it's just been the worst thing. And because we're the workforce of the Merrimack Valley, from Newburyport to Lowell, if you got a business, our people work in it. And, you know, a lot of food manufacturing, things that were essential workers, you know, grocery stores, things like that, people moving essential products. So it's been really tough. We had 3,925 people to date, 135 dead. You know, we've been marked as a red city by the Commonwealth, which means we could not go to hybrid with the DESI standards. So we did as close we could, which is, you know, we have the students that are special ed and English language learners. It's about 20% of our population are going to be in school in a hybrid method. And so I think that, you know, we're dealing with a lot of the same things. You know, we had to deal with the humanitarian effort. Luckily, well, unfortunate for us, we went through the gas crisis in September of 18. And then we had like this muscle memory of how do we help people, food and housing and the like. And so we made sure that we were getting people food insecurity situations. So that happened very quickly. Calling people every day, hey, I know you don't have the virus, but are you okay? Especially the elderly of all people. Making sure they got what they needed. You know, Meals on Wheels change and how we did that. Grab and go bags for people to get food. Make sure that they could pay rent. We're in the process of using some HUD money to make sure people are not being evicted. We were one of the first cities to implement a moratorium on rent, on evictions, even before the state acted. It's really important just to give a signal that, you know, that keeping people in their homes is going to be important under the crisis. And then we kicking and screaming, all of us kind of put together a regional response to the homelessness. We have a wet shelter, much like Gloucester has, and it was just not big enough. And so we got a shelter in Methuen and a shelter in Andover to deal with a lot of this homelessness that was happening because of the crisis. So I think, you know, as we go forward, it's going to be the issue about employment. How do we get people back to work? And we get people to wear the mask and social distancing. We started to do this funny thing this week where we, if you got a call for a noise violation, we have noise ordinance in the summertime. People that play music too loud, usually a party. So every time we went to a noise violation this weekend, we considered it a spreader event. Say, hey, if there's probably a party there's probably more than 10 people. That place is probably going to have a problem with the spread of COVID. And we're going to have the state police help us out with that. And anybody we find on the travel list, because the state's keeping a travel list, people who come in by plane, we're going to visit their home and make sure they fill out that form. You know, you can't implement that they actually quarantine, but you can make sure that they know that they have to fill out the form. And we're hoping that that'll do the effort. But this has been really challenging, especially on the tails of the gas explosions in the Merrimack Valley back in 18. But I think people have been resilient, and we're ready to go, you know, to move on. Hopefully you get the medicine to get people feel better long term and get back to the new normal.
Thank you. Mayor McGee?
Thanks. So we're I think we've been on calls together, so we've been really identifying the challenges we all face together and what we do. I think, to talk a little bit different piece of this right now, because we're in the red zone. We're at about 4,369 total cases since it started, 17 new cases today. We're over 700 still active cases. So I think the messaging, and I think we got to shake up the messaging and the communication to let people know this is not over. The virus has not taken a vacation. Everybody's tired. They've let their guard down. But for us to move through this together, it really is in each community, and each community is different. We have 17,000 students. We're trying to, as we're going we're going to be going fully remote, but really that's a challenge in itself. But it really is, how do we shake up the messaging and really get people to comply? We had a great month in July where we were really low. We were down in the single digits for over 4 weeks, and we're starting to head back up again. So I think all of us need to continue to message and communicate to people that we can together limit the spread of this and work with our businesses and our schools and all of the things I think that we've talked about on together this morning. But I think we need to continue to send a message in a way that allows people to understand that we need to continue to work together to limit the spread. And that means, it's the same messaging: wearing face coverings, social distancing, not large gatherings, not having these parties, making sure that the supermarkets continue to be vigilant on what they're doing. We have one of the largest market baskets in the market basket system, with all kinds of people going in there. Is everyone still wearing their masks? Are they doing things in the store that make sense, where people are coming together? So how do we get the right messaging out instead of saying over and over again the same thing from the leaders in the community? And how do people in our community who've had either impacted by being severely ill or have lost members of their families to this terrible virus, how can they help us in terms of the messaging so that we can continue, as I think Dan, you said, as treatments come online and hopefully a vaccine is on the horizon, we need to continue to be vigilant so that we can keep the businesses open that are open, but people need to comply and be smart and work with us. And I understand, I heard a doctor who was on and talking about, he said, I know people don't want to wear a mask. I wear a mask 14 hours a day. I don't like wearing it either, but I'm doing it because make sure that we're all safe. So Elisa Milano was on a YouTube. I don't know if everyone has seen this. I've mentioned it on a couple of calls. She's 47 and she has COVID, and she did a YouTube when she had a brush, started brushing her hair, every 10 or 15 seconds, pulling all kinds of hair out of her brush. And it was pretty painful to watch, to be honest with you. And at the end of it, after she went through all of the things that impacted her, the hair piece, I think watching that was very powerful for me. And at the end, she said, wear your damn masks. So how do we continue to let people in our community know that we're in this together, and that we need to continue on following the right guidelines, like not having, 30 people at a pickup basketball game at the basketball courts, or gathering together in groups in the parks, or going to parties, or making sure we're doing what we need to be doing. Because unless we do that together, we're gonna rebound back to where we were, and we don't want to do that. So it's incumbent on us, I think, to try and shake up the messaging and maybe try and do it together in a way that we get people in our community to be part of that discussion. Because there are ways to limit it that allow us to, I think a number of us said it, the new normal is trying to get through this in a way that we're not locked up in our homes, but giving a chance to be out and let some of the businesses get back to where they can at least make some money. But that involves us being smart and do what we need to do. So that's.
Thank you. And that just goes to
those are my
proof with all
thoughts.
of us. That
Those
just
are
goes proof to all of us. We're all in different boats, but the same storm. You know what I mean? It's one storm, people. Kim, are you still there?
I am. I'm here. Yep.
Yep. You're on low, but we can hear barely, but yep.
Any better? Maybe not.
I can hear you a little bit. Put your volume up.
Yeah, I just tried that. I'm not sure.
I hear you fine, Kim.
Okay, great.
Now it's
Yeah,
better.
Perfect. Just echoing what everybody else said, I think we've all been learning how to build and fly things at the same time as we're learning our way through this pandemic. It's great to have the camaraderie of other city leaders to both engage with, sort of bounce things off of, work together on programs, because the virus doesn't know a city or town limit. And I think that has certainly proven its course over the last several months. We're feeling it this week because we're in the red zone. That's an area that has had increased case counts. So we're really trying to bring people back together and remain vigilant, or go back to the vigilance I think that we had a couple of months ago. That just human nature with warmer weather and the ability for people to get out more, we're seeing some upticks. There doesn't appear to be a trend, or it can't be tied to any one particular aspect of industry or people. So we're really trying to make sure everybody remains vigilant, because now it could be anybody that's contributing to the cases going up. So like all of you, struggling with what's the best of the worst decisions with respect to a lot of things, schools in particular. We're now going all remote, super worried about families and kids who going all remote is problematic, just don't have the support system around them. And obviously concerned for teachers and staff who are equally scared about heading back if they're immunocompromised or have family members that are. So I'm hopeful that everyone's better angels can come together for all of these conversations. We're going to need to hunker down again and get ready for whatever the second wave brings us.
Sefatia, you're muted. I know Dan's got a hard stop at noon.
Right, we're gonna leave now because Rick really can't get in. Anyone who can record this, I don't know how to do it. I'm not one of the hosts. Says, can you keep the recording for him? First of all, I want to say to everyone, thank you, because it is. I mean, we were joking in the beginning, and it's kind of nice to, realistically say, what, we're all having a difficult time, but yet we still respect one another. We are different in each communities, and we're all going through the same exact thing. It's just like I said, different boat, same ship, and it's hard because funding and everything else, but it's an emotional wreck because we're losing our friends, we're losing citizens in reality, and then you have some people who just don't give a hoot. They don't care no matter what, and it's constant fighting. And I tell them, I don't know ever in my life when I ever heard a virus become politically involved. Republican, it's a virus, people. It's a damn virus, and it's killing people, and face reality, because they are. I don't care, and I hate it when they say it's just, the old. It's not. And now, because they kept saying that, all these young kids who just didn't give a damn, they're all out doing stuff and everything else. And, one life God, this one, we had it too, the same thing. It's over and over. It's hard. It's hitting everyone, it doesn't matter the age. And I pray for all of us all the time. And what's really hard is because I know it's coming back. I really do. Because like you said, it's been so long, and everyone just said, we're tired. But keep up the good fight, everyone. If you need anything, or for, moral support or whatever, just, you have my cell. I'm here all the time. If you guys need anything or whatever, please reach out. I know I do. Sometimes I just send you a little joke or something because I just can't take it. I have the governor now with Bruce Todd. We found a deer on the beach, and he's walking around. I said, see, even the deers love our beaches. And so the governor responded, well, is he going to a party? And Mr. Bruce Todd, no, I don't think he can. He has no dough. He's looking for a buck. I'm going to stop. But that's their dry sense of humor, but it's better than nothing, because once in a while, we all need to. So thank you, everyone. I have to actually sign off. Thank you. And
Thank you.
Stay healthy.
Thank you all.
Please.
Good to
Thanks,
see
everyone.
everybody. Take care.